I know we're still waiting on your cam.
I'm still an orphan. Yeah.
It's okay. We won't start without you. So just a quick run-of-show rundown for everybody else. Confirmed, we'll start here. The County Executive, Dr. Branch, will do just brief remarks, after which we will move you all over into the two table spaces. Essentially lane one where the woman in the pink is getting her shot. 4 folks have already gotten their shot this year as faith leaders to share their solidarity. 5 faith leaders will be getting their shot. So we'll give you B-roll to folks doing that. While they're waiting, you can get straight to testimonials and we'll get you guys whatever you need and get you on your way. Hopefully, story in a box.
You just need me here?
Here.
Here.
Yep.
Thanks.
I don't have the written copy.
That's fine. Thank you.
It's okay, you're not the last straggler. Phil's got us up too.
Where's my pillow?
Good morning.
Hello, how are you? Okay, good. Two minutes.
Sure, happy to be here.
Appreciate you being here. We'll track her down, Doc. Hey, Sean, you track down Elin for Dr. Branch? Oh, you found her. There you go. Very good. You guys all set? Very good. Well, good morning, and thank you for being with us this morning for an update on the vaccination effort that's ongoing here in Baltimore County. As always, I want to thank Dr. Gregory Branch and his entire team at the Department of Health for their tireless work to get shots into the arms of our residents here in Baltimore County. The mass vaccination work underway is truly unprecedented, and I believe that we have the best team in the state to carry out the work. Before I start with our vaccine updates today, I first want to remind people that this virus is very much still with us, and people are still getting sick and dying. With the Super Bowl ahead this weekend, I want to ask our residents to continue to please stay safe. The data is clear. When people gather, COVID cases spike. We saw it through the holiday season, and we're just now returning to our pre-Thanksgiving levels. So don't host or attend large gatherings. They are the perfect environment for the virus to spread among the people you love and care about the most. Instead, watch the game from the comfort of your own living room. Order out from one of our great local restaurants. We see the light at the end of the tunnel, but now is not the time to become careless. If we continue doing the hard work, wearing masks, practicing social distancing, avoiding large gatherings, getting your vaccination, we will save lives and we will come through this. I am pleased to be here today in Randallstown for the first day of Baltimore County's second vaccination clinic site. Adding a second site here on the west side of Baltimore County is a critical step forward in expanding access for all of our residents. Today, we will have about 500 residents receive their first dose of the vaccine here, and we'll be offering more dates at this location in the near future as supply from the state allows. Meanwhile, we're also continuing to plan for an expansion to a third site on the east side of the county in the near future, as we also continually look for other ways to expand access in the weeks and months ahead. So far, more than 74,000 Baltimore County residents have received a first dose of the vaccine, with more than 26,000 of those doses coming directly from the health department. More than 18,000 residents have now received their second dose. And we have continued to vaccinate our first responders and our oldest residents in line with the state process. As part of Phase 1B, our health department also continues to provide appointments to BCPS, which has in turn distributed appointments to their priority groups. Dr. Branch's team is also continuing to work with BCPS to enable the school system to stand up their own vaccination clinics for teachers and staff alike. And we're proud of the progress we've made so far, but we know that there is still a long road ahead. This week, we received only 4,825 first doses from Maryland. That is nearly 3,000 fewer than we received last week. Meanwhile, more than 200,000 people have registered with Baltimore County to receive a vaccine. Of those on our registry, nearly 40,000 are over the age of 75, and nearly 60,000 are between the ages of 65 and 74. We also have nearly 20,000 registrations who have identified themselves as K-12 educators or staff. In Baltimore County, we have the capacity to vaccinate all of these people very quickly. But like every jurisdiction across the country, we are facing a very limited supply of vaccine. While I'm optimistic that we will begin to see an increase in that supply after President Biden's commitment to that goal, we must also accept the reality that it will take some time for that supply chain to ramp up, and that we are still at the end of the supply chain in local government. I know that many residents are anxious to get vaccinated as quickly as they possibly can. It is our commitment that as we get doses, we will continue to put them in the arms of our residents as quickly as possible and in accordance with state guidelines. In addition to limited supplies, I also want to recognize and acknowledge another critical challenge facing our communities nationwide. We've seen stories across the country about disparities in vaccine distribution. Baltimore County is no different. Of our 205,000 people on the registry, only 11% are African American, while our population is 30% here in Baltimore County. Latino and Hispanic residents account for only 1% of registrants, despite making up 10% of our population. These numbers are particularly concerning when you consider that communities of color nationwide have also been disproportionately impacted by the virus. Now, we can't point to any single reason for these disparities. We certainly know there are concerns about access to a computer and the internet, which are necessary to make appointments through the state's system. But we also know that many people of color have been more reluctant to receive the vaccine. They have legitimate questions, including whether the vaccine is safe. We think it's important for them to hear from voices they trust. That's why I'm honored that today we were joined by a number of clergy from across the Baltimore region and here in Baltimore County. Pastor Sheridan Allman from the Mount Olive United Methodist Church, Reverend Christopher Burnett from St. Stephen's AME Church, Pastor Charles Sembley from Union Bethel AME Church, Pastor Jimmy Baldwin from Shiloh Christian Community Church, Pastor Robert Anderson from Colonial Baptist Church, Bishop Walter Thomas from New Psalmist Baptist Church, Reverend Harold Carter Jr. from New Shiloh Baptist Church, and the Reverend Patrick and Reverend Sherry Claiborne from Bethel AME Church. Today we're also joined by school board member Cheryl Pasteur. We've asked them to join us today because we want them to share their stories with their congregations, with you, with our communities. And our faith communities have been such critical partners throughout our fight against COVID-19, so I'm grateful to have their support in this effort as well. The partnership with faith leaders is just one small part of what will be a larger effort to reach every community. And in the coming weeks, we'll be rolling out a campaign focused on educating the public so that they know this vaccine is both safe and it saves lives. And moving forward, we will continue to look for every opportunity to reach across Baltimore County with a critical message about the safety and the effectiveness of the vaccine. This is a marathon, not a sprint, and we need your patience. We need your partnership as we continue striving towards our ultimate goal, ending and defeating this virus. We're approaching now the 1-year mark of COVID's arrival in our community, and I know our residents are tired of staying away from loved ones, tired of remote learning, tired of wearing a mask, tired of working from home, tired of the financial hardship that has affected so many, tired of social distancing, tiring of restrictions on our life. But I want to thank the people of Baltimore County for everything they do every day to keep themselves, their families, and their community safe and healthy. I want to ask them to hold on for just a little bit longer while we work to get vaccines in the arms of our residents and get through this long, dark journey. We can see the light at the end of the tunnel. We just have to keep pushing a little further. At this point, we'll turn things over to Dr. Branch for a few remarks, and we'll open up the questions.
Good morning, everyone. And I thank you, Mr. CE. I am still excited. We have opened our second COVID vaccine site, and I want to take this opportunity to invite everyone to complete the vaccine registry on the Baltimore County website. I especially encourage all of my African American and Latinx communities who have been hardest hit by the pandemic to sign up and be vaccinated. Not only is it important, it could mean the difference between life and death. I have to take this opportunity to thank the health department staff, my deputy health officer, Della Leister, for all of their hard work. Adding this second location will certainly make it more convenient for residents on the west side to be vaccinated. However, vaccine supply remains limited. We are still serving people in phase 1A and 1B with special attention to our seniors age 75 and over. We do not know at this particular time when we'll be able to begin vaccinating those in 1C. We ask that you please, please, please continue to be patient. And we are continued with the commitment of practicing the 3 W's by wearing your mask, watching your distance, and washing your hands. It's just that simple. So please, just do it. Thank you.
Dr. Branch, I think this may be a good question for you. How do you explain opening another location or plan for another location if we still don't have enough vaccines in the first place?
Okay, so we must always be ready. And Baltimore County Public Health is always on the job. So I can't wait for you to now say to me, Dr. Branch, you now have 20,000 vaccines. When that occurs, I can guarantee you that we will put it in the arms of people immediately. You can see we're ready. Why the place is so empty today is a lack of vaccine.
Dr. Branch, is there any discussion, or could there be discussion about adding a zip code into the prioritization perhaps after you get out of 1A and 1B? Washington, D.C., for example, is doing that to try and make sure that they can close the gaps in the disparities?
I think all of those ideas and thoughts are great, right? So I think that as we are working through this and as we get more vaccine, we can actually then dissect and do a surgical approach to actually getting people in. At this particular time, if I've got 200,000 people on my registry and you're giving me 5,000 vaccines per week, at this point now, it's just a matter of kind of giving out the best way I can give it out. But once I'm able to get more vaccine, I think we can definitely take those types of approaches. We are committed to ensuring that the populations most hit hardest by this COVID vaccine, by this COVID disease, will receive the vaccine. I am committed to the communities.
And Kate, I think that marries your question and Mackenzie's question about having a location here. It's not just about having additional capacity, it's also about taking direct action to address those disparities that we're seeing with the distribution and with the uptake. So going into the communities that have been underserved and that don't have sufficient number of vaccinations relative to our population, it's a way to sort of extend our reach even as we have so much more capacity. Dr. Branch will tell you he can do almost 1,000 vaccines an hour at our Timonium site. This is additional capacity, but we could do the 5,000 vaccines in one less than a day. So we've got more capacity, but we want to make sure we're also going into the community to get those vaccines distributed.
Sorry, Mackenzie, I thought you were going to ask this. I asked this of your counterpart earlier this week, County Executive. Can you give an explanation about why your supply of dose 1 was cut by 3,000? And do you know if those 3,000 doses are staying in Baltimore County?
I believe part of the explanation is that the state is also now ramping up their partnerships with pharmacies. They are doing, they're standing up their mass vaccination sites, both in Prince George's County and Baltimore City. But again, we're ready to be a mass vaccination site in Timonium. We're ready to go into the community at places like the Randallstown Community Center, the east side of Baltimore County. We're ready to explore mobile units, but we just don't have the doses. So we would just continue to urge the federal government, the state government to give us the vaccines because people know us, they trust us. We've been recognized as a model, not just for the state, but for this country in terms of how efficiently and effectively we deliver. So, I certainly, that's part of, I think, the differential this week, but we want more, we need more, and we'll serve our people better the more we get.
County Executive, can you talk about the teachers? I know you had said that there's an effort to get a lot of the teachers vaccinated. what would that look like? I know a lot of teachers are anxious to get back in the classroom. A lot of parents are anxious to get their kids back.
Yep.
That seems to be a head-butting issue at this point.
Yeah.
What would that look like to get teachers vaccinated to make sure that they feel safe?
Well, what we can control in Baltimore County, we are, which is why we did the $11.5 million of PPE that will be in place before schools return, according to BCPS's plan. It's why I wrote a letter to Governor Hogan and appreciate him moving teachers to be eligible as part of 1B. What I can tell you is that Dr. Branch, and he can speak to this more perhaps, is coordinating directly with BCPS, not just to set up their own pods and their own vaccination clinics, but to also ensure that the school system is actually prioritizing those who are scheduled to go back first, so that we are really prioritizing those who will be in first and the longest to get their vaccinations first as they have their plan. So I don't know if you want to elaborate a little bit more.
Exactly what the county exec said. So we've been working with the school system, and we work with not only the public school system, but also the private school system. And so at this particular time, one of the things we're preparing with is teaching them. They have 140 some odd nurses, right? Teaching them to be able to give the vaccine to their colleagues. And they can actually use this type of a setup. So we're helping them through this process. They have been working with us each and every day, trying to learn the whole process of doing this. Once we get the vaccine, then they can go ahead and just do their vaccine while I'm still doing the community, right? So we're ready and willing and able to be able to do that. So I think that right now, we don't want to forget the school system in any way, shape, or form, and we're trying to give the school system, we're supposed to give them 100 doses per week. And we've given the school system more than 100 doses per week at this particular time. And we're working very, very hard, but we've got competing people, right? I've got the school system, and I've got folks over the age of 75.
You've had COVID yourself, you've received the vaccine. Why do you think there's a hesitancy, especially in the African-American community, to get the vaccine? From your personal experience, from the people that you've talked to?
Well, from my personal experience, I can say that COVID is one of those diseases that I would not wish on my worst enemy. I will say to you the fact that I feel blessed that I was able to get through COVID unscathed. But I do know that there are so many people out there who have not and were not able to do that. So many people who look like me have succumbed to that disease. And so I have to say to everyone, we need you to get the vaccine so that you can prevent yourself from potentially getting a deadly disease. Now, why? There's a lot of history when it comes to the persons of color and how they were treated in medicine. I know what happened. I'm not going to negate what happened. I'm just going to stand here today in 2021 and say, as your health officer, this is not an experiment. As your health officer, I am recommending it, and I recommend that everyone gets it, and I started out with myself first. So I would not have given it to myself. I would not have someone give it to me if I felt that there was something wrong with it. So I implore everyone, please come out and get the vaccine.
Dr. Branch, one more question, because you just deplored that you don't have 10,000 people showing up here at this site. Can you just give us some of the basics of the logistics and how this is running? How far ahead of their appointment do they come? Are you meeting people out? They bring documentation?
So what happens at this point now is once you sign up for the registry, we then send the links out. And once you receive the link, you can then go on and attempt to register. Once you get an appointment, we outline exactly what you're supposed to do at the particular site. You can come to a Baltimore County site at your appointed time. There is no need to come much earlier than your appointment, but you can only come if you have an appointment for that day. And when you come, you can get through our lines very, very quickly. It's less than 15 minutes, if it's that much, and then obviously you have your 15-minute wait. I can tell you that when I walked in this morning, there was a senior who was standing outside with her walker. And I spoke to her and said, are you okay? And she said, I'm waiting for my daughter. Where did your daughter go? Well, when I went in, I told her she can go get a cup of coffee and maybe get something to eat. And she said, I just did not realize that I would be out so quickly. So I stood there and talked with her for a while, and then her daughter came, right? And so I want people to understand, when you come to Baltimore County for a vaccine, it is smooth and it is efficient, okay? Because we want to be able to get the vaccine into people's arms. And I do not want my 75-year-olds trying to stay in a car or stand in line for hours. We cannot have that. That can be just as detrimental. All right then.